Good afternoon. First of all, I thank the department, the government of Tamil Nadu, also DPH sir, for inviting us to participate here and also speak on the today's topic, the VPD surveillance system, which is going to be transitioned to IDSP in the coming days in the entire country. So this is the outline that I'll be speaking about, little bit about what is the vaccine preventable disease surveillance in India that is happening, and a little bit about how it all started with National Polio Surveillance Project, and also the IDSP which is going to take over that, and little bit on the transition itself, and what are the concerns and challenges of this transition that is going to take place, which is being supported by WHO and PSP for almost 3 decades now, and what is the way forward. So if you look at the VPD surveillance system in India, it mainly encompasses, of course, it started with poliomyelitis, and then measles and rubella, then diphtheria, pertussis, neonatal tetanus, and also the outbreak investigation that happens for all these diseases. And just from this year, as per the request of Government of India, we are also supporting typhoid surveillance. As far as the poliomyelitis surveillance is concerned, this is how it began, way back in 1997, the conventional acute flaccid paralysis surveillance system which is there, and we are also supporting the IVDPV surveillance. VDPV is vaccine-derived poliovirus, and the long-time excretors of poliovirus because of the immunocompromised children. That is something which we are supporting to track. And of course, the environmental surveillance. There are definite identified points in the entire country where the sewage samples are collected, and we are supporting that system also. Before I go into the other systems, I must mention here, it is Tamil Nadu which had this system much before the country. The country started in 1997, but Tamil Nadu state actually had this system, the polio surveillance system, much before WHO started it in India. So just a little bit background, Government of India, in collaboration with WHO, started this National Polio Surveillance Project way back in 1997. The basic idea was to initiate the acute flaccid paralysis system in the country and support polio eradication. This is how it all started, the vaccine preventable disease system in India. And after India was certified along with other countries as polio free in 2014, NPSP started supporting other surveillance like measles rubella surveillance, DPT surveillance, and now the typhoid surveillance also. So this is the structure till recently. The Government of India and WHO had put up, the system was there in the entire country, and as you can notice, most of these field offices were mainly in the northern part of the country, UP and Bihar, with minimal presence in the southern part of the country. And this was supported by the WHO accredited laboratory, both for poliomyelitis, measles, rubella, and also DPT, and in the recent times for typhoid also. So which are the key areas that this system was supporting? First and foremost, of course, is the VPD surveillance system. The idea was to sustain polio-free status of the country, which it has achieved already, and implement the polio endgame strategy in India, accelerate the measles rubella elimination strategies. India has stated that it is going to eliminate measles rubella by December 2026, which we are supporting, and conducting lab-supported diphtheria, pertussis, and neonatal tetanus, which we are already doing. So this is the main support that we have been providing as far as the VPD surveillance system is concerned. And just to give you an idea, what is the scale of operations, in a huge country like India, definitely I'm just want to show that FR cases is fever rash cases. If you look at last year, there were more than 1.12 lakh fever rash suspected measles rubella cases, and this year also there are almost 66,000. So I mean, each of these cases get reported from different levels, right from the field, from A&M level to the the higher centers, and maintaining this system, nurturing this system is something very, very important. And once the cases get selected, go and investigate these cases, write a case investigation form for these cases, whether it is timely, whether it is complete, look at the quality, and also see that this entire data is entered into a system, and then do the epidemiological analysis and provide evidence for decision making for the policy makers. This is the very critical thing that that is going on. I am just showing you here the measles. This happens for the polio also. This happens for diphtheria and many other vaccine preventable diseases. So this system is also supporting for routine immunization. I will not get into the details of this, and in many other areas. Now ministry has decided to transition this to IDSP. IDSP, all of you know, it is there. It is pan India, started sometime in 2004, and it has a system, inbuilt system, which goes down to the primary health center level. They have their own laboratories, their own systems, who can definitely take over this, this additional responsibility of vaccine preventable disease surveillance. So there is a background for this transition. It was actually being discussed way back in 2018, how to really go about this transition, because basically India wanted this to be integrated into IDSP. So this is being going on for a very long time, and since January of this year, this has taken prudence, and it is going on in a fast track mode. So as I told you, transition is a decision of Government of India, and WHO India strongly supports this. And funding for this, which has been given to this NPSP, it is going to end by March 2027. And after that, it is the state governments which will have to take over the entire functions of VPD surveillance system. And all the functions will be, of course, will be taken over by the IDSP. And there is a system to enter this. There is a surveillance information management system which is being operated by NPSP for all these vaccine preventable diseases, which will be integrated into IHIP in the coming days. It will start with VSIMS, and finally it will get integrated into IHIP. So this is the transition plan. As I told you, it will happen in 3 phases. The first phase is already over. This August, we have already transitioned almost 1/3 of these, units. Almost, 280 districts in this country have already transitioned, and some of the states have completely transitioned, and some of the states have, partially transitioned. And, the end will come in March 2027, wherein the state governments, the IDSP, will be individually handling this surveillance system from then onwards. Just to give you an idea, this is the first phase that has already happened, and the highlighted districts are those where the transition has already happened, and many of them which are there in green have completely transitioned. So there is no presence of WHO NPSP who are there in the field level, and others are in the process of transition. And in the south region, I can quote that Telangana and Kerala, they have completely transitioned. They are managing the system on their own, and in other states, the transition is in progress. So what was the process? A system which was built almost 3 decades back. How is this? This was transitioned. Basically, there were training materials that were developed. There was capacity building that was done in each of these districts, and handling over of all the surveillance related documents for all the last 30 years related to polio, measles and diphtheria, they were all handed over. And as I told you, the VSIMS, which is the Surveillance Information Management System, the credentials were also handed over, and many of the districts have started operating this system on their own. And post-transition, we are also supporting them in identifying what are the gaps there and supporting the state and the districts to, for a smooth transition. So, I mean, this has started, and the phase 1 is already over. And what are the challenges that one can see? What are the concerns and the challenges? The major programmatic challenge, comes, from the polio program. If you know that, the entire Southeast Asia region is already free of polio. I mean, one of the things that, comes to anybody's mind is maintaining the polio-free status. Will our surveillance system be sensitive enough to really pick the cases if the wild polio virus gets imported, or if there is a vaccine-derived polio virus, if it emerges within the country, or if it gets imported. So, I mean, that is something, which the program managers at the state level should be, concerned of, and see that the sensitivity is maintained. And the second thing, of course, India has, MR elimination is a flagship program in India, and that is something where, we should be really, focused. The other thing is, transfer of these skills and the knowledge that has been there for the past 3 decades to, some, personnel who are dedicated to do this within the system is something which, we see as a challenge. And, not all states are in the same phase. Like, for example, Tamil Nadu is at a better stage, the transition may be very smooth here, but there are many states which still need some support, and there may be some issues which needs continued support from Government of India and WHO. And another thing is about the loss of independent technical support and feedback that was being provided by WHO and PSN for this program. Some of these surveillance are very, very sensitive. They are targeted for eradication and elimination, which really requires some independent body to look at it and, support the states and the nation. Probably that is something which is, which will not be available. So with this, what is the way forward? WHO India fully supports VPD surveillance transition and strengthening, the domestic systems. And different states are at different levels of transition based on the public health capacities that are there in those states. IDSP will have to quickly take over this responsibility and mitigate the programmatic risks that I have, mentioned. WHO India would continue to support this both at the state level and the national level. And the polio network, which is already there, it is supporting the country in the Gavi HSS3 in bringing down the zero-dose children, mostly in the northern part of the country, and also keep supporting the VPD surveillance in the country. And also there are discussions with, some states, what would be the support that is expected or required at the state level from WHO. These discussions have already started. So, I mean, this is the way forward that we see, and we really, from WHO India, we really, thank for this opportunity, and also wish all the best to IDSP, to take it forward. Thank you.